Well, good afternoon, everybody. Welcome, welcome. We're so glad to have you here, and I think we're going to go ahead and get started. We are Zooming too, and unfortunately, I may have to stick my head around to see if anybody's trying to join us while Gavin's talking, so I hope that won't be too disruptive. I think I know everybody. I'm Kathy Zarling, one of your two parish nurses. Jody Hellickson is here today too. And we're really excited about this presentation because, as you know, Caring Connections is really to bring health information to all of our congregation, to our parishioners, so that all of us can make the best health decisions for ourselves and our family. And so we've just recently learned about this new initiative that you're going to hear about today. But let's just start for a few minutes and have a short meditation on self-care as a sacred stewardship. And I know you're asked to do this in presentations once in a while, but it can be effective. We're going to just sit grounded with our feet on the floor and just take 3 nice deep breaths together. So whatever your activities have been today, Heather and Jan, whatever, let's just take a minute to get grounded. And what I've always been taught is as you breathe in, count to 3, hold your breath for 3, and then let it out. So let's do this 3 times. Okay. In, 2, 3, hold, 2, 3, and exhale, 2, 3. Make sure it's your tummy that's moving in and out, not your shoulders up and down. Another one, inhale, 1, 2, 3, hold, 1, 2, 3, and exhale, 1, 2, 3. And once more, in, 2, 3, hold, 2, 3, and then blow it out through your mouth. 2, 3. Very simple to do, and as Jody and I know, and the other nurses that take blood pressures, if somebody comes in and says, "Oh, my blood pressure's high today," if we just have them sit in the chair for a minute and take 2 or 3 deep breaths, it makes all the difference in the world. It's amazing how we can calm our bodies. Do we know that our bodies are temples of the Holy Spirit, and He is in us? And we have received this from God, from 1 Corinthians. Self-care, what it is and why it matters. Self-care is the ability of individuals to maintain health, prevent disease, and cope with illness, with or without professional supports. Some of the forms of self-care are physical, exercise, sleep, nutrition, mental, emotional, meditation, journaling, therapy, medical, self-monitoring, blood glucose, blood pressure, medication adherence, and social. It's so important to have healthy relationships and boundaries. Regular physical exercise can prevent up to 3.9 million premature deaths every year. And self-care reduces stress, boosts productivity, and enhances emotional resilience. It's not indulgent, it's essential. And when I always talk to patients, I'll say, self-responsibility is not being selfish. It's taking care of yourself first, so you can always take care of those you love around you. So informed choices are combining reliable medical facts with personal values that lead to better outcomes. Patient empowerment are people who actively participate in their own healthcare decisions, report higher satisfaction, and feel they have better outcomes. So one of the most important ways patients, individuals, can be empowered is to ask questions, understand their health, and always be their strongest advocate. Steps to wise decisions are to clarify maybe what you're being told, what decisions you have to make, gather good information, accurate and unbiased, consider your own personal values and lifestyle, and discuss with your valued healthcare provider and loved ones what you want to have done. And always weigh the pros and cons, which will make the best thoughtful choice. So just a few scriptures that relate to rest and renewal in our life. Matthew 11 says, "Come to me, all you who are weary and burdened, and I will give you rest." Jesus invites us to find rest in Him, reminding us that rest is not a weakness, it's divine wisdom. Think about that again. Rest is not a weakness. Being vulnerable is not a weakness. It's divine wisdom. Mark 6, verse 31 says, "Then, because so many people were coming and going that they did not even have a chance to eat, He said to them, Come with me by yourselves to a quiet place and get rest. Even Jesus encouraged his disciples to step away and care for themselves. And I know in many discussions we've had at church lately, we'll talk about the fact that even Christ took time for solitude and self-care. We don't often think of that because it doesn't talk a lot about it, but it was certainly there. And then on caring for our body, 1 Corinthians 6 tells us, do you not know that your bodies are temples of the Holy Spirit, and therefore honoring God by caring for your own body? Caring for our physical and emotional health is a way of honoring God. And then lastly, some scriptural reference on mental health is from Philippians 4. And we've heard this one before. Do not be anxious about anything. Depend on God, who transcends all knowledge. And with that, I have this prayer, and it's a prayer of wellness. And so bear with me. I usually create my own, but this one says quite a bit. Heavenly Father, thank you for the gift of my life and body you have entrusted to me. Help me to honor you by caring for myself with wisdom, grace, and intention. Teach me to listen to my body, to rest when I am weary, and to nourish myself in ways that bring strength and healing. May I always remember that my body is a temple of your Spirit and that caring for it is an act of worship. Guide my decisions, Lord, especially those that affect my health. Give me discernment to choose what is good and courage to turn away from what harms. Help me seek balance, not out of selfishness, but out of stewardship, out of self-responsibility for the life that you have given me. And surround me with support and remind me that I am never alone in life's journey. May your peace guard my heart and mind, and may your wisdom lead me in every step. And with that, we ask you to guide our discussion today. We thank you for bringing Gavin to us to talk about health initiatives within our environment, in our Rochester surroundings, and also lead us and guide us so that we make the best decisions and care of our temple that you've given us. In your name we pray. Amen. Okay, sir, you are on. I should introduce him first, right? This is Gavin Jacob, and Gavin has a degree in health administration, and he is currently the Director of Operations here at Health Bridges, which is a new initiative that he'll tell you more about it. The home office is in Winona, where he hails from, but they're starting to spread around the area and have, as he calls them, different pop-up clinics, but he'll tell us about that. So help me welcome Gavin Jacob.
Okay, thank you, Kathy. Thank you all for showing up today. I think that introduction was a perfect way to kind of segue into the information I have for you today, because Bridges Health truly does value connecting not only the population at large, but specifically older adults with primary care providers, getting them thinking about their health, and get them taking an active role in their health, which is something that not everyone kind of inherently knows to do. So like Kathy mentioned, my name is Gavin Jacob. I've been working as the Director of Operations at Bridges Health for the last 2 years at this point, and I am very happy to share what we do today. So starting off, I just wanted to give you a high-level view of what our mission is as an organization, and that's to deliver holistic health, so all of the aspects, not just the physical, and wellness services to communities like yours through transformative interprofessional learning experiences. And that's where our staffing comes in, which we are actually staffed by students, health profession students from nursing, social work, public health, dental hygiene, and a variety of other disciplines. And that's where that interprofessional word comes into play. We find through research and through our own experience at clinic that bringing all those different majors together, the nursing, the social work professionals, they can create new creative ideas and kind of tailor the experience to the individual. That's why services through us tend to feel a little bit more personal and a little bit more tailored to your individual needs. And then moving on from that, our vision is to empower our communities to fully achieve their optimal health and wellness aspirations and cultivate an exceptional workforce of interprofessional leaders. And essentially what that mouthful means is that's kind of the goal from our mission, what we're aiming to achieve. And then our service region, which is the most kind of important piece on this slide for you folks, is mostly southeastern Minnesota, the counties of Houston, Fillmore, Olmsted, of course, and Winona. And then we also dip a little bit into western Wisconsin. So if you know anyone from Buffalo, Trempealeau counties, we also service folks over there. I'm going to give a quick overview of this slide, but this is essentially how Bridges Health is made up. We have our executive director, who is my boss, Dr. Jen Tim. She was a nursing professor faculty at Winona State before eventually transitioning to the executive director of our own organization, Bridges Health. Then under that you have the director of operations, myself, and our clinical education coordinator, who is also someone we work with to get everyone kind of organized here. Under that, that's where you see our contractors, our volunteers, external faculty partners, council, but I'd like to point special attention to our students at the bottom there. We take students not only from the undergraduate level, but the graduate and doctoral levels, and that's across all disciplines. So a big part of attending our clinics is to actually give these students an educational experience. In fact, that's half of what we do, is providing these students with experiences that they won't get at other clinical placements. So how we do this is through an integrated care model with a preventive, person-centered approach. So that means we build the services around the needs, preferences, and goals of the individual, being you. Then we emphasize early intervention, risk reduction, and lifestyle support, whether that be through blood pressure screenings, a Alzheimer's and dementia check, a social needs screener, whatever it may be, just to emphasize the importance of connecting with a primary care provider, with your clinician, with whoever it may be, maybe a nutritionist. And just little changes you can make without connecting with any of those, things you can make at home, little routines you can add to your life. And then we center on a health promotion and self-management support kind of model. So we don't necessarily diagnose or prescribe medications at our clinic. However, we do promote self-management, health promotion tactics. And that assesses the physical, mental, emotional, social, environmental needs, so that kind of holistic piece that we were talking about earlier. And we develop shared plans and interventions with the person and any caregivers in their lives. To do this, we also leverage local community-based supports to support well-being. We partner with churches like this one, community buildings, community centers, activity centers in the area, local clinics, local public health departments, pretty much anyone who wants to help support our mission and has some people they can send our way, we love to partner with, especially if they share our values. And then we also collaborate with other community organizations like public health departments, kind of already went through that. And we focus on outcomes, improving their quality of life, their mental health, their connections with primary care. Maybe they haven't seen their general practitioner in 3 years for a physical and it's about time, that sort of thing. And then engagement with other community-based supports outside of the clinic, whether that's a chess club being run or a pickleball team, anything to get them more connected and more active if they so desire to be. Now this huge list here is the services we currently offer. Now I want to mention first and foremost that all of our services are free of charge. They do not require any proof of insurance, whether you have it, don't have it. We don't need you to apply to be qualified for this. Anyone who walks through our doors gets all of our services for free if they desire to. One of our biggest services that I really want to highlight is foot and nail care. We offer free foot and nail care through the nursing students for people of any degree. We never turn a foot away, we say. But that's definitely the biggest one we bring in. Foot and nail care can typically cost a pretty penny, especially for how often it needs to be done. So it's just one of those quality of life things that really makes a difference. And as we're doing it, we do a foot soak, we can do a neck and shoulder massage. It's really a whole package where you get to feel really pampered and really special during our appointments, which typically range around an hour. 45 minutes to an hour is typically what it is. And we like to spend that amount of time with our clients because we want to make you feel important, we want to make you feel heard, and we want to make sure we can address what we can address while you're with us. So beyond foot and nail care, you'll see we have things such as fall prevention, brain health screening. Let's see here, I'm trying to find some highlight points. Oral health is a big piece. You'll notice on one of our flyers that we passed out, the one that's targeted towards veterans. That one is specifically veteran focused. However, that clinic offers dental services to people of all backgrounds. It's just this semester they tend to focus towards the veteran population. So with that oral health, we have fluoride application, oral cancer screenings, denture cleaning is a big one. And then a whole laundry list of other services there that are also listed on that kind of white and green folder under services. And then of course, if there's anything we can't do or anything we don't currently offer, we don't just kick you out the door and then say that we can't help you there. We do our best to refer you to a source that's affordable, local, in your community, and hopefully get you on a better track. And then finally, a service we offer that's not on this list or the flyer that I'd want to mention real quick is our caring call service. And that is a service offered by our social work team and graduate level nursing, where we give clients once per week a 30 to 45 minute call. Now that call isn't to the degree of therapy or anything clinical like that, but it's a nice check-in call with a group of students who have notes on what you may have called about last week, if you meant to call your sister this week or talk to your neighbor, or if you wanted to set goals for yourself like cleaning the basement, for example. That would be a team that would call you if you chose to sign up, and they would go over those goals with you. So that's another excellent service. Going into our schedule, I'm specifically here to talk about our St. Charles date, which is highlighted on that flyer that you have. Now, Bridges Health services a lot of different locations, and we pop up clinics in each of them. So we kind of have a traveling clinic team. We bring a trailer and everything. So the most local one to you folks would be St. Charles as of right now. But I'm also here to say that starting as early as late winter, early spring, we are going to be starting up more 10-hour clinic days in the Rochester area, specifically through our partnership with Winchester Wellness, which is highlighted on that other folder. They're the dental clinic that's run out of RCTC. We've been trying to get a 10-hour clinic there for a while now, so I'm happy to say that this following semester will be the first time we will. But I certainly encourage you, if anyone is willing to make the drive out to the St. Charles area, we run a clinic right out of their city hall. It's a beautiful space. There's tons of accessible parking in the back, and we promise we'll make it worth the drive. So as for how to make an appointment, first off, you would call the number here, which is also listed on those flyers, so you won't have to write them down if you just want to take one of those. And then what we do, it's typically me that's going to answer. We will find you a clinic location that's close to you and try our best to find an appointment time that works for you as well. Now, our clinics typically run on Thursdays, but that's going to change to a different day of the week shortly. I'm assuming Tuesdays for the Rochester area. It's all based on student staffing and where we can get the most team members out to you. And then I just put a note saying that clinic dates are sparse due to our current staffing and volunteer group sizes, just working with the students we have and making sure they get enough varied experiences. But we try to reach each of our communities 4 times a year, and that's at minimum. So as we're expanding capacity-wise, I definitely want you to keep us in mind because clinic dates are only growing, they're not shrinking. And then, as I mentioned before, we partner with the Dental Hygiene Clinic, so I wanted to say if you are in the market for dental hygiene specific services, if that's oral cancer screening, denture cleaning, fluoride application, any of that, I would suggest that you call 507-280-3169, and that's the direct number for the dental hygiene clinic at RCTC, so right here in town. And then with that, I just wanted to open the floor to questions, large group discussion. I'm here for any and all questions.
I have a mic. I'll talk loud enough.
Gavin, where do you get your funding for this? Who pays your salary?
That's a great question. Yeah, so for our funding, I wonder if I should wait for the...
Yeah, just a minute here. I'm going to use that for questions because we want you to be heard.
Sounds
We want
good.
everybody to be heard.
I was going to say, I can
We've
shout.
got to hear your answers. So, just reframe that.
Repeat it.
Yeah.
Yeah.
Gavin, who pays your salary? Because this doesn't run on nothing.
Yeah, so I'm not doing this for free, although we did start off, me as a student, I volunteered my time, but ever since I started as a staff, Bridges Health, including my salary and these clinic operations, this is mostly grant funded for the majority of our funding. We do accept donations, and we are very thankful for any donations we can get. However, our main mission is to make these services free, not even low cost, just flat out free. So donations are always accepted. We do occasional fundraising events, definitely want to do more in the future, but mostly grant writing, either from the state, we'll get state funding, local funding, sometimes federal, but that can be dicey, so.
So is your grant writing done through like you folks, or is it done through nursing at the schools at that level?
Right, so yeah, we do all of our grant writing for us. Back when we were partnered directly with Winona State and a part of them, they would kind of help us out and we'd get some student groups, but for the most part, myself and Dr. Tim works on the grants.
Okay. So how do you differ from your program versus like, I'm thinking of one that I had written down that's available for people through like senior linkage line,
Okay.
that sort of thing that people I know have already tapped into.
Good question. So for one, a big appeal for us is our service area, where service is typically very disconnected from health opportunities. Obviously in Olmsted County, you folks are very lucky to have the resources you do. However, I believe our other benefit outside of just filling the gaps is also having those students there. Those students giving you plenty of time to express any of your needs during that hour, really talk with them, connect with them, find out those things about yourself that you might not have the time for in other sources, while also providing them really truly valuable learning experiences that they might not get at other placements.
Okay, and lastly for now, how do you partner with mail? Where does this come in with mail?
Good question.
So we're going to have to ask, or if I were using your services,
Yeah.
I would ask my physician, my family physician, how she felt about that.
Yeah.
You know, so I just am curious your relationship with mail or Olmsted, either
Right.
one.
Yeah, with Mayo, Olmsted, or any healthcare provider, through our model, we provide any referrals through a formal kind of method to your primary care provider. We make it very clear that we aren't diagnosing anything. We are providing recommendations through the students, and we tend to, whenever we enter any new community, make ourselves kind of known to those health providers the best we can. Sometimes we don't always reach every provider. They might be like, who's Bridges Health? What is this? And obviously it's up to the individual providers whether they want to honor a referral or not, but typically, worst case scenario, they would say, okay, well, we see that you have this recommendation, but how about we check things out before we take their word, which is fine too. The goal is to just get that connection with the primary care.
So did I miss, are you going to be located at the Heinz Center when you up and start the clinic in Rochester?
Yeah, that's a good question. So our physical office won't be located there. We'll still be in Winona, we'll still be traveling, but with the clinic itself, yes, that will be located in the Heights Center in their clinic space.
Great.
So fairly accessible location for here. We've also partnered with, I don't know if any of you are familiar with LifeGate Services, which is in Rochester. It's just a local food bank that runs here. So we've considered opening a clinic location there as well. But we're scouting out locations outside of the Heights Center to potentially open 2 clinics rather than 1.
So where's your clinic in Winona? Do you work with Winona Health in Gunderson?
Good question.
Can you repeat that, Chris? Will be hard to hear.
Where are you located in Winona, and are you affiliated with Winona Health in Gunderson?
Good question. So Gunderson, we don't have as much of a direct affiliation with outside of, they're aware of us. We've referred many of our clients to seeing their primary care provider at Gunderson. Winona Health specifically, we've worked with their team before. They've sent people out to our clinics as kind of resource guides. We've also partnered with one of their referral directories. So we have some deeper ties there just because we've been in the Winona area longer. But as for locations, we have 2 clinics as of this point in Winona, one of which is at Hiawatha Valley Mental Health Center, which used to be the old Winona Health Urgent Care building, and that's right on Sarnia Street. And then the other one is at a building called Sobieski Lodge. It's a park building, and that's on the east end of town. I don't have the address memorized, but that's one of our oldest sites. So those 2 spots have been great for us. They're both on bus lines. That's what we typically try to look for. And then we work with some other organizations in the area. A lot of the nonprofits in Winona partner with us and send referrals to us, and we definitely get a lot of word of mouth in Winona. Thank you.
A couple of questions. What schools do you get your pool of students from?
Yeah, great question. I was hoping to, I must have forgot to add that slide there. I was wondering where that was. But yeah, we get students from a variety of different schools. Now, a majority of our students typically come from Winona State nursing on the undergrad and grad level. But we also get social work students from Winona State, we get public health students, and we get health leadership administration students from Winona State. Outside of that, our second biggest partnership that we started was with the dental hygiene program at RCTC. So we partner with those students, and that has been a very fruitful relationship ever since we started that. And then finally, where I was referred to you wonderful folks from, we partner with the Viterbo Direct Entry Masters of Science Nursing program. And they have just been wonderful. It's been our first semester working with them, and we were really impressed with their professionalism and their attitudes towards clients. So, and then besides that, we also partner with Lutheran College, which is in kind of northern Iowa. They have some students in Rochester that'll travel around, but we're expanding every day. We're working with building partnerships in Mankato, UWL, potentially St. Mary's down in Winona. We're open to any partnerships. We want the largest group and the most varied group of students we possibly can.
Second question, how do people find out about the clinics? Specifically, how will we in Rochester find out if and when you have a clinic up and running in Rochester?
Great question. So outside of the word of mouth and me doing things such as this, the outreach, typically we'll work with partner organizations to get the word out, whether it means sending a flyer to this church, sending information to this church, local churches in the area. We look at churches first, because you folks are passionate and you have strong communities here. Second, we go to community centers, maybe a local grocery store, anywhere we can get a flyer or some word of mouth going. Community centers and gyms are also a good part of that. And then besides that, we have a social post that we put occasionally on Facebook, or ask our partners to put on Facebook for anyone who wants to find us digitally. And we have our own website as well, which is just bridgeshealthwinona.org. And that's where we put an updated list of our clinics, our services, including a contact form and a way to see kind of what we're up to. Thank you.
Have you connected with all the vet clinics in the area? We've got a big one here.
All the veterans clinics, you were saying?
You want me to do it again? Do you ever go to the veterans clinics? We've got one in Rochester, and I think some other cities have them too.
So our veterans outreach is fairly new for us. It was something that, as I was working with Dr. Tim, I recommended recently, especially with our veteran population growing, our older adult population growing. It seemed to be a kind of missed service of ours. So not at this point. We don't partner with them, but that's something we're looking to do.
Information with them.
Right. Work in collaboration in some way.
Gavin, one other question. There was also, I believe my son shared a fair that you do.
Yes.
Is it yearly or whatever? We also partner with the group Pablo and some of those places. And just wondering if that would be, if you could share a little bit of information on that, if that would be a good resource for us to use as well. Because your fairs, I heard very good things.
Yeah, so the fair that we run once a year, that's in collaboration with LifeGate Services, which is that food bank. And LifeGate Services also operates out of another church in the area. I wish I could remember the name of the church off the top of my head.
Is that where the headquarters for LifeGate is in the local church?
Correct,
I
yep.
was just going to ask you where it was located.
Yep, right in the local church. It was just an initiative that they started. So every year they do a health fair that is run by them, but we staff and we kind of help plan and get organized for, and we run a clinic out of there as well. So that's a yearly event that's open to everyone. That's run in September. So it just ran recently, but that's definitely something we would advertise for, and it's open to everyone in the public. It's a really fun time.
One of the things that I see right away is this Bridges Health. You shouldn't it doesn't just include, what I look at this as St. Charles.
Mm-hmm.
But, so if I live in Rochester, I would be done.
Right.
So if your Bridges Health Clinic included these counties, then people would actually look at that more and say, oh, well, they really are in Rochester.
Right.
Okay, so my second is, do your students get paid, or they're doing this for their doctoral or master's program and are not being paid?
Good question. So to answer the second part first, our students aren't being paid because it's a part of their program. However, after their time's up with us and they come back to be a volunteer, what have you, then that's kind of where things change. They may be paid as grant funding allows for project work they do as not a part of their program. It's kind of up to the individual programs and the schools. Some schools reimburse students for mileage, some don't. Some say it's just a part of your learning. So it's kind of up to them, but in terms of our experience, we try to pamper them as much as possible as funding allows. But to answer your first question, or your first statement, I totally agree that that's a major just kind of shut-off point when you see that. We do have individual flyers for each site, so that kind of helps with the problem. As of right now, we don't have a flyer for Rochester, as that site's still being kind of built up and worked on. But also to your point, it would be beneficial to have maybe a second flyer with all of our sites, that information, in case maybe in November someone that could go to Houston, Minnesota, for example, or what have you. So
Another idea for you?
yes.
Contact all churches with parish nurses and give them the information.
Yeah.
And actually from the state, you can get all the parish nurses in your counties.
Excellent.
Contact them.
That's a great idea.
That's a plus for you.
Thank you.
We all have a list of questions, but one question I have, Gavin, is so say an individual wants to have some screening done.
Yes.
And would they call your main number, the 474, and say, I would like to have a dental screening, I would like to have some foot care done? Would they call, well, the foot care was separate. No, the dental care had a separate number. But what I'm wondering is, for a person to get started, if they just call that number and say, these are the health needs I have, how would I proceed? Then they would set up appointments for them.
Yeah, great question. So kind of how that process would go about. First off, the dental services do have a separate number, but occasionally at our clinics, we do have dental students come in. So, if you call our number, we can always connect you with those dental services as well. So I would say that first number, that 474-2221 is kind of your primary contact to start with. But yeah, as you call and you kind of say what services you're looking forward to or like hoping for, we would, regardless of that, we don't have to prep our team in any way for those services ahead of time, because we bring all of our materials, all of everything for our clinics in those mobile trailers. So from our point of view, all we need to know is kind of what you're looking for, what you're expecting, and when you get to the appointment itself, you could say, hey, I'm here for foot care, for example. And maybe the students will be like, well, do you want to, while you're here, while we're doing your foot care, do you want to talk about some social needs you may have? Or, I just want to ask these questions for the screener. And if you're not having it and you're like, I just came in here for foot care, then you can say that and they'll be like, okay, perfect. And then they'll talk to you about your day, and that's all there is to it. But if you are open to some of those additional screeners, then that can come into play. Or vice versa, if you said, obviously if you didn't come in for foot care, we're not going to take your shoes and socks off and say, yes, you did come in here for foot care. So it's very tailored to the individual experience, but we offer everything to everyone.
Hi Gavin, I'm Kim. To pick up on what Jody said, I'm one of the volunteer teacher mentors, whatever I am, with people of the book Lutheran Outreach. And we have many students that we help whose English is not their first language, and they're here as refugees or immigrants.
Yep.
Couple of questions. One, could they bring one of our volunteers who speaks their language as their interpreter? Two, are they allowed to come because they're not citizens?
Great question. So yes, anyone can come regardless of citizenship. That's not something we're going to ask or critique at our clinics. It's not our job to. And second question, both great questions, but yes, they can definitely bring one of your volunteers as an interpreter. We've had couples come in where, maybe the person's wife or husband just wants to sit in and chat because they don't want to be apart from them for too long. We allow that, and we're not very strict on just directly the students with the person. If anyone doesn't have an interpreter and needs one, they would just need to let us know or have someone let us know ahead of time as they're making the appointment. And we actually work with a service called Project Fine, which operates out of Winona and up to the Olmsted area to provide translation services. So they're an excellent resource too. We've partnered with them for years. We don't get a ton of non-English speaking clients, but they're certainly welcome.
By the way, Redeemer is the kind of primary church supporting Pablo. So just FYI for you, there's many, many different services that they go back and forth between Pablo and Redeemer.
Perfect.
Now what were my questions? Okay, two. One, is there an age limit? You have to be a minimum age of 18 or something. And two, this is not meant as a criticism, this is meant as I experienced this.
Yeah.
So one of our students was here with her son from a foreign country, and her English was not great. And she asked me to go with her. I just kind of took her in like a daughter, I guess. And he a grandson. So I was sitting in Mayo Clinic doctor's office, and they had an interpreter who spoke Farsi. She was from Iran. And well, the doctor had to leave the room for a few minutes. And so the interpreter said to my friend, the mom of the child that was being cared for, that she didn't understand why she was chosen as the interpreter because she had no medical background. So are any of your interpreters in that situation where they interpret the language but they don't know what in the world they're telling?
Yeah, or saying.
The doctor or the patient?
That's a great question, and I apologize, but you'll have to remind me of the first one after I answer this.
A minimum age.
Minimum age, thank you. I knew it was a quick answer one. I'll say that one before I forget. There is no minimum age. We've seen as young as 6, and we've seen as old as 105. So we take everyone. Our services definitely appeal to those, I'd say 40 and up. But we love getting youth in our clinics, people around the 20s, 30s, all of that. For our interpreters, through Project Find, they're highly vetted, and they've been working directly in clinic environments, so I would be surprised if they did. That's kind of why we avoid, sometimes we'll have a student say, oh, I took, 3 years of Spanish in high school, or something like that, and we avoid those situations. We appreciate their help. But we don't want to cause any issues with the interpretation or any missed words or anything that can affect the patient/client experience. Yeah, of course.
Do you keep records on the people that come to visit? And so you can look back at them to see where they were at when they first started as to what they are doing now?
Great question. Yeah, so and that's exactly why we do keep records. So yes, we do, and that's why, so we can reference those old appointments and know who you are if we have a new batch of students. Maybe myself or our executive director will remember you and all that. But we have such a rotating batch of team members that's another necessity. But we do everything through an electronic health record system that's safe and secured. It's called Practice Fusion for any of the medical professionals in this room. Kind of a pared down, electronic record that works for our purposes. But yeah, everything's safe and secured. We have every single one of our clients fill out a consent form that goes through how we can't sell off your health information, release it anywhere. The students aren't allowed to use it outside of clinic, mention your name, anything like that. We have them sign contracts for that, complete training, all of that. But yes, we do have a record, and we can see, patient A came here for this last time, recommended this for follow-up, that kind of thing.
So Gavin, I've worked with grants and stuff, so I have to ask this question.
Yeah.
I hope your money doesn't run out.
Yeah.
But I have worked with grants and know that it can.
Yeah.
So are you confident, in being granted the money for now, but going forward? It's just, I think the program's great, but
Right.
not everybody who grants the money does. So
Right.
I'm just asking.
Yeah, no, it's a great question. I mean, grant funding is a scary world to be in.
Oh.
It really can be. And, even back when I was a student and took many classes in grant writing, which is how I got my training for it, they made it very clear to us that on a good day, about 60% of grants get accepted. And that's on a good day, which we're not always in. So yeah, it's definitely a scary world, but we are, Jen, myself, and any students we have partnered with grant writing. Occasionally we'll get a group come in and say, hey, we'll help on this half of the application for you. We take a very aggressive approach to being at the forefront of that, having creative ideas, creative initiatives, one of which, that's one of our larger grant initiatives from the state, is our long COVID work, which is a very innovative thing that Minnesota is working on, studying the effects of the COVID-19 virus after someone gets better. What are those lasting effects? So we've developed a screener that we're hoping to get used through the state of Minnesota. My boss has presented for the state of Minnesota through that. So we have good ties to MDH, the Minnesota Department of Health, through that. A lot of our grant funding comes through them. However, there's no guarantees in life, but that's why we have made a lot of strides to diversify our funding, move into those fundraising, accept those donations, rely on our community as they rely on us. So.
Speaking of, what sort of fundraisers have you done, and are there any planned, and what areas are they in?
Yeah, great question. So we've done kind of ribbon cutting fundraisers in the past. When we opened our new office, when we started a new clinic, we'll have little kind of banquets and events where people can pay money for a ticket, get a dinner. You know, the cost is a little bit more than the dinner, but that goes, you know, all proceeds go to us in our clinic running. Some initiatives we want to do in the future would be outside of just that Winona community. You know, a majority of our clients are in Winona as of right now, but that's changing rapidly. As we're doing more and more clinics, we're seeing other, you know, even St. Charles, Houston, Preston, you know, Fillmore County. Our clientele there is expanding rapidly, and we really want to do fundraising not as just a means of getting funds for us, but really connecting with the community outside of just the clinics.
Most of you on this
One
part.
more.
Oh, but I got the wrong end here. Oh, man, you did.
Yeah, that's typical. So, where are your other clinics other than?
Yeah, great question. So outside of Winona and outside of St. Charles, we have a clinic that we're running actually this week in Houston, Minnesota, so a bit of a trek down. We have a clinic in Fillmore County in Mabel, Minnesota. We ran one in Preston last semester, but we're trying out different locations to see what best fits for us in Fillmore County. Besides that, we have a couple of our programs in Rochester, like LifeGate and Winchester Wellness, which are our partner clinic sites. You know, the dental and the food bank. And then in Wisconsin, we run one clinic at Milton Town Hall, which that is right on the edge of Fountain City, which is right on the edge of Winona across the river. And then we run a clinic in Blair, Wisconsin, which is in Trempealeau County. And those locations were strategically picked both from research we did for grants, from community partners asking for us, whether it's a county, Fillmore County asking for a clinic site there, or a community organization asking for us, something like that. And that's what we have as of right now.
What about the referral process? Is it all self-referral, individuals calling, or do you ever have a referral from a physician, for instance, concerned about someone who maybe doesn't have health coverage, who maybe just needs some good screening in some or all of those areas?
Yeah, we've gotten a few referrals from physicians in my time. You know, it's not enough to where I say it happens all the time, but it's a good handful of them have come from physicians. We get a ton of referrals from social workers in the field, a ton of social work referrals. I think getting referrals from physicians and working closely with those health systems would be a good improvement to make as we're growing and expanding.
Yeah, as the word travels.
Yeah.
Yeah, and the other thing is social workers. Are they the county social workers, or would you maybe have a Olmsted County, or Olmsted Hospital, or one of the Mayo Hospital social worker call, knowing you exist and they're sending somebody home that might need some services?
It's often in the hospitals, like Olmsted County. We've gotten a few from the county level or the state or county government, but yeah, mostly from hospitals or in-home care facilities.
And when she's done, I want you to say a little bit more about the caring calls.
Yeah, of course.
That sounds interesting.
So this is something near and dear to me and to my daughters. There's a lot of Americans who really are reluctant to fill out the advance directive paperwork and all that kind of paperwork, because it isn't just one form.
Yeah.
But since I work mostly with these international folks, they have even no clue that the United States does this,
Right.
but yet they're living here. So do you have counselors or people who might help people not fill it out, but understand the importance of it and maybe guide them in some way?
Yeah, it's funny. Currently, we don't. However, it's funny you should mention, because through every semester we have doctorate nursing students who do projects with us, and that's actually one that we're working towards, is advanced directives, both for English and non-English speaking patrons. So that and any other legal forms that you need to know at a certain age, that's important to have a good grasp on. So it's funny, it's as if you gotta look into my secret files on future projects. Sounds like I keep hearing things we're working on, but thank you.
This actually comes out of Kathy's presentation, but I'm going to ask you. So I've lived in 8 states, about 15 different cities, 2 foreign countries, and I think that I'm the way I am now because of that.
Yeah.
It was very challenging to have to move that much. So the reason I bring that up is I'm much more comfortable than I think I would have been speaking up when my doctor is wrong.
Yeah.
There's a whole lot of people that aren't. And by just telling us that we should be doesn't make that so. You have to learn how to do it, why it's important to do it, especially the older you are. You know your body a whole lot better than someone you might meet for the first time.
Right.
Maybe your doctor retires and then you start over, but even though there's a record at the particular clinic, it's still not the same person.
Right.
So is there a way that you help people kind of buck up?
Yeah, good question. That's a big.
You have to offer coaching, right, Kim?
Yeah, I can be one of your coaches.
Well, there we go. There we go. We might need more team members. Yeah, I think we could definitely do more, is what I'll tell you, is we could definitely do more, as I'm sure we could do in a lot of different ways. But we do, as a big part of our mission, really push for advocating for your health in all ways, and really remembering, even just as an individual, that yes, you do know your health. You might not know what a certain number means when you get a reading, or you might not know to look for something, but in terms of your overall health picture, outside of just the physical, your social, your emotional, environmental, all of that, you know yourself very well. And that's why we try to spend a lot of time with you, so we can get the best picture of that as we can, but at the end of the day, we're still just spending an hour with you out of your entire life. So that's something, as we are kind of referring, that we try to make clear to our clients, that if you're feeling a certain way, or if you express to us while we're kind of motivationally interviewing you, if you express a concern to us, to take that to your primary care provider, to take that to someone who might not be as approachable. Maybe your doctor is very blunt and quick, and yeah, here's the numbers, here's what you need to do, whatever it may be, and it might be a little intimidating to say, well, hey, I don't feel great about this, or I want to check into this. But that's what they're here for. That's what we're all here for, and we try to send our clients with that attitude. Thank you.
In regard to the caring calls, you mentioned them a little bit. Is that usually a follow-up of somebody coming for screening or care? Could it be helpful if someone has a new diagnosis or something that they need some support and care with? Would that be something that you would do through the clinic, where people could get those weekly calls? You mentioned working on goals. If any of us would have personal goals, is that something that can be, designed for someone to be called? You said once a week, I think they get a caring call. Is that right?
Correct. Yeah, it's once a week as we have students, and as we're setting up the calls and talking to our clients, we say, here's this schedule. We'll find a time that works for you during the day that we call, and then we set up that 30 to 45 minute call. So yeah, that definitely, you can follow up on things from clinic. Everything in the calls is as private as it is in the clinic itself. The only mistake that we try to correct is when we're recommending caring calls, we try to make it very explicit and very, apparent that the calls aren't a replacement for therapy or counseling, and rather just a team that can talk with you from Bridges and connect you with some resources. So yeah, in terms of following up on care, goal setting, all of that is a big piece of caring calls. We want to, as we expand that program as well, we want to make it more telehealth focused for folks that want to specifically follow up on clinic visits. We haven't seen that as much in the past. Most people that use our caring calls program really just want those check-ins and that person to talk to weekly. But for those that want to say like, hey, I don't have a Bridges appointment for another month because you won't be back in Winona by then yeah, we would love to to set up.
Do you have telehealth capability?
We have the capability.
Can you Zoom with people that are in a different community?
We can, we just need to expand on that and like create that program. Get the students staffed for that. That's something we want to start as early as spring. I just don't want to promise it yet if it's not set up until halfway through spring or what have you, but it's always been a goal.
Great information. We're all jotting down questions to ask here. So currently your programs are at spot locations, and by calling that number, people can find out, you know, how soon it's in St. Charles or Rushford or wherever. So if a Rochester person, until there's something in Rochester, could actually drive there or have access. Okay. And Thursday nights are the clinics currently, but Tuesdays being looked at for the future, you said.
Yep,
At least in Rochester, maybe that's how you meant it.
Yep. The one in Rochester is most likely going to be on Tuesdays because that works off of the dental clinic's plan or like their schedule. And for Thursdays, just to clarify, that's from 9 to 5 is when it's open on those Thursdays.
And you mentioned the 10-hour clinics.
Yes, so the 10 hours, that's a bit of a slip of the tongue of me. That's 10 hours for the students, that's 8 hours for the clients. So just a little bit of a correction there. It's 9 to 5 for clients. Students are there from 8 to 6 for setup and tear down. We do get people that show up early, so sometimes we have to pop up a station quick, but yeah.
Kind of a garage sale, people come an hour early.
Exactly.
Seeing people lined up at the door, yeah.
Exactly.
About nursing students, do they have trouble not providing diagnostic information? I think that would be hard for me.
Okay.
Because,
But as a student, you think, is that what you're asking?
yeah,
So like in the sense of do the students have problems providing that kind of information to the clients or like
you have to
delivering?
be careful not to use diagnostic
Right.
wording.
Right, yeah, and kind of how we word things too. You know, we an example I can think of is when we were doing foot care, we always trained the students not to use words like, oh, let me just, you know, dig in there real quick, or like anything too graphic, because that can scare some people away. You know, as funny as it is, and some people laugh it off, but we really train them in their orientation to use the right wording, take your time with clients, you know, even if it's their first clinic and they're a little nervous, you know, that's why we have supervision on site and we have licensed RNs watching them, or licensed social workers watching the social work students, in case there's a situation where they're panicked and they don't want to ruin the appointment or it's a tough case, then, you know, they step out as needed or I'll help coordinate it when I'm at clinics, so. Yeah, we obviously, you know, mistakes can happen, but we train them the best we can.
Are your RNs and your social workers, sound like they're on staff of Health Bridges, but do they come like from RCTC background, or are they from other health environments or health settings? How you do that?
Yeah, good question. So they're independent contractors through us, which is another way we can kind of save on our funding and make it as lean as possible with how we're funded. Yeah, they're independent contractors. They're reimbursed for their mileage and supervision time, but outside of that, they don't have the necessary salary. So they come from, you know, Winona State for our nursing and social work faculty. Dental hygiene comes and they bring their faculty over to watch their students. Depending on the relationship with the program, like I know our Viterbo students don't have direct supervision as long as we set up with them which licensed RNs are supervising from which schools. You know, we're very lucky to have the staff that we partnered with for years be, you know, friends of Bridges and not just a business relationship, but really engaged in our mission. But yeah, that's kind of how it's set up currently.
It's just a wonderful organization, and I just think it sounds similar to the migrant health clinic that Winona State worked with back when I was experiencing that, and it's wonderful for the clients because they're getting care that they're not stressed with having a lot of payments.
Yeah.
And it's wonderful for the students under supervision of people that really work out in the community to really grow and gain a lot of knowledge and experience in the community areas. It's wonderful.
Thank you.
Any other questions? You've had great questions. John? You want one male comment? I said Gavin and John are our two male
Oh, yeah,
representatives.
gotta represent.
So if there's something that's happening, I mean, we have a weekly email blast that goes out for our congregation, of which we put this program in, and if there's like an event, and like you just mentioned, the health fair, we could put that in, so Redeemer members could come and learn more about the program. And, you know, just if people think of any ways that we can better communicate back and forth, that would be great.
Yeah, and you know, we would love to provide as much information as possible. You know, I really wish we had some Rochester clinics lined up yet this fall for you folks, but I had to come here. I needed to. I felt like this is going to be a great opportunity, and I'm so glad that I did, because you've all been super pleasant, and I love the questions. But yeah, you know, as clinics pop up and as we expand into the Rochester area more and more, we'd love to have you. Love to have you check it out, and we'll make sure that information gets to you. For sure.
Anything else?
You were delightful.
Thank you.
Thank you. Wonderful answers to all the questions. Let's see if Eddie, we got all the questions, okay? And one thing I want to mention is our next meeting, and I don't have my phone, the second Monday in November. I didn't glance at what that date was, if anybody has their phone handy. But, I'm sorry, the second Monday in November, and we're pretty sure our speaker will be one of the clinical nurse specialists from Mayo on diabetes care for yourself and those you love and care for. So, yes, ma'am.
It's November 10th.
Thank you. Thanks, Kim. So November 10th, 3 to 4:30, our new time. Thank you all so much for coming. And if you have topics you want to hear about, we just were so fortunate to learn about Gavin's organization through Jody's son, who's a graduate nursing student, and his experience.
That's how you found out about it?
Yeah.
Ah.
And he's doing clinicals with them. He was very impressed. So he said, Save, I got a topic for you, and it's wonderful because there's so many opportunities like this in the community, other than the large medical centers, that people can reach out to. So we're so glad you were here. Okay, with that, shall we just end with the Lord's Prayer? Let's say the Lord's Prayer and then we'll be done. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory, forever and ever. Amen. Okay, thank you all so much. Have some refreshments before you go. And maybe Gavin can stay for a minute if you have any.
Say hi to my old
Yeah, I will do.